Welcome everybody to our discussion today. I thank you for your attention. We have the honor to have Ms. Beverly Gibson, who is an expert in regulatory compliance and chief in revenue cycle management, coding, and medical documentation. We are going to have discussions today in what to expect from population health, chronic care management, remote patient monitoring, and some of the behavioral health integration for 2022 regarding its compliance and its financial feasibility for healthcare systems and independent providers. With that, I would like to introduce Ms. Beverly Gibson. Please, the mic is yours.
Well, thank you, Stan. It is a pleasure to be here today. Just to give a quick overview of my background, I have been in this arena for about 25 years. And over the years, I've gotten a couple of degrees, one as a master in education, and then another one in MBA. I have a few certifications, 6 to be exact. I am a certified coder, I'm a certified instructor in coding, and then I'm also an auditor, and I have 3 certifications for that. One is as just a professional services auditor. The other one is for E&M coding. And another one is for forensic services. And then I'm also certified as a medical practice executive, which gives me some insight into revenue cycle management. And that's about it as far as my background.
So if you could discuss some of the complexities and some of the tasks you were handling as a consultant in the healthcare field.
Okay, well, right now, my main task is to serve as an expert witness. And I do a lot with chronic care management services, laboratory services, and also some in podiatry. So, but that's just what I'm working on now. Over the years, I have been involved in 12 to 15 medical specialties.
Thank you very much. If you can give us an overview of what the industry can expect and the changes that were issued by CMS for 2022 in the chronic care management space and remote patient monitoring space, that'll be very helpful. If we could start from the regulatory side, and then we're going to go towards reimbursements and expectations for documentations and quality.
Well, actually, on the regulatory side, for both RPM, remote patient monitoring, and for CCM, chronic care management, there have really been no changes as far as regulatory guidance, but I would like to go over at some point today some of the guidance. It's been around for a while, but it's complex. There are a number of facets to it, so I wouldn't mind going over that. We do have some good news as far as reimbursement, so we can talk about that whenever it seems to make sense during the presentation.
Awesome. Why don't we start with an overview of what chronic care management is, who is eligible, and how does a practice that currently is engaged in chronic care management space or are planning to implement the processes within their patient population health initiatives need to go about selecting a system, setting the bar for quality, looking at their outcomes, and also knowing the codes and reimbursement, as well as documentation criteria that are required in order to maintain compliance.
The first thing to know is that chronic care management services are measured by time. So it's really important that time is measured. And at CCM Health, there's a unique way of doing that. The actual electronic health care system measures that. And in fact, all of the conversations with patients are recorded. So that's another way of measuring time. but they're measured in 20-minute increments. A provider can bill for up to 3 sessions, so that would be up to an hour. And in this case, all of the time is performed by clinical staff. So that means at CCM Health, there is a nurse that is spending virtual time with your patient under your instructions and guidance.
What is the definition of a clinical staff? If you could please elaborate for the listeners.
Well, clinical staff can be a nurse. It can be, well, as in a registered nurse or an LPN licensed practical nurse. It can also be an MA. But at CCM Health, nurses are used and the medical assistants are not used. So I think that's speaks to the quality of the staff time.
What kind of level of documentation can one expect to have to feel that they are ready for an audit if one was presented and feel confident that their documentation is up to par and is compliant, and that speaks to time and documentation of time and logs, as well as that speaks to the depth of the clinical interaction and the documentation that is produced upon completion.
So I discussed how time is recorded at CCM Health, but in terms of what's produced, there are 2 aspects. One is the medical record itself, which is a summary of what has been discussed. But in addition to that, there is a comprehensive care plan that is produced for the patient. And of course, the physician can see it as well. But that's what the documentation looks like.
So if we're going to take a random patient and we're going to say, hey, this patient was receiving services for a period of the last 12 months, would we have versioning of care planning, or would it be a single document? And what is the guidance of the type of versions should a company that's providing the services have on file?
Well, if you're doing it over a period of 12 months, then there would need to be 12 care plans, because a care plan is produced every month. And then there would be, for each of those months, there would be documentation that one shows how much time was spent, who spent the time with the patient virtually, and then there would be recordings of that. But in addition, there would be notes that would be in the system. Some of those might be a summary of the discussions with the patient, but there could also be a summary of discussions with other healthcare professionals, such as physical therapists or respiratory therapists.
We know that chronic care management ultimately takes a village. It is a team approach, and often several professionals within the practice handle the discussions. I know you touched the point that time is recorded. I want to make sure that it's clear as far as how does one have to expect to measure users and time, and is that time handled separately, or does that time add on as a bundle as far as sum for the months, and who is considered time spent qualified versus not qualified?
There are 2 types of people who might interact with a patient. And one would be clinical staff and the other would be non-clinical staff. Non-clinical staff might be just an administrative person who is calling to get some details about the patient or to provide some information. And while that time is recorded, and in fact that information goes into the medical record, the time is not counted towards the 20 minutes because only the time of clinical staff can actually count towards billable time.
Thank you. If you could touch on the point, because we know that the description of the CPT code is pretty vague. It does say that you need to document time. How can one assure that the time is documented and is not tampered with? And how can one be sure that the time that is documented was really the time that was spent by the user, that it's indeed documented in a patient's file versus by somebody else?
I already mentioned that all of the conversations with the patient are recorded. So that's sort of a backup, but the actual way that it is done is that it is recorded in the system itself. So when a person, a user, opens up the CCM Health system, the EHR, then that at that moment, the time begins to be recorded. And when they close down that patient record, then the time stops being recorded. And so in that way, it can be tabulated. I will say, though, that not all of the time, even if it happens to be the registered nurse who is working in the patient record, not all of that time is actually counted. At CCM Health, there is an entire department of quality assurance, and those folks go through the records of each patient, and they verify that what the registered nurse was doing actually is sufficient in quality to count towards the 20 minutes.
Can we touch on aspects of signature and signature requirements, and how do we handle electronic or wet signatures? How are the providers supposed to document and sign off on care planning before it's distributed to patients and care plan sharing?
Well, it is not a requirement of Medicare that clinical staff signs off on the EHR and on their notes and on the care plan. But at CCM Health, we still do that. And so there is a way that electronically, the clinical staff can look at what they have done, and when it meets approval, then they sign off on it. So there's a date, a signature, the credentials of the clinical staff. And then in addition to that, the care plan goes to the physician for approval, and the physician needs to approve them. And there is a way for them to do that electronically right in the EHR.
Thank you. So in some of our other educational sessions, we cover what care gaps are, and then our listeners know that our job is to identify care gaps and document those gaps within the system, and essentially facilitate care coordination between the patient and the provider to assure the care gap closure. But if you could touch on that subject, at least from the regulatory side, on how the information flows from the nurse to care gap documentation, appointment setting within the EMR, and how a physician liaison facilitates the communication with the provider, making sure that nothing falls through the cracks, and we close the medical care gaps in a timely fashion to decrease risk for patients and ultimately reduce healthcare spending.
So one of the purposes of CCM is to provide a comprehensive care plan for the patient. And it is patient-centered. It's an electronic care plan. It focuses on the particular chronic conditions that are being managed, but it also includes an assessment of other physical factors, and also factors such as mental, cognitive, psychosocial, functional, and also environmental. And then there's an inventory of resources that's produced, and that addresses the findings of the assessment. And then at that point, there can be gaps that are identified. And of course, the provider is notified of those, and to make sure that any gaps that are found can actually be closed and remedied by the provider.
Thank you very much for that answer. I would like to touch the subject of managed service organization and the structure of our relationship with our network providers, whether they're a healthcare system or they're independent provider. The responsibilities that are spread between our organization and the contract provider. And if you could provide an overview, that'll be very helpful.
Well, some of the responsibilities of CCM Health are to obtain a patient consent before any services are rendered, and then to document it in the patient's record. And during the public health emergency, we're authorized to do that. I did want to talk a little bit also about the responsibilities of the provider, the physician. And one of those is that the patients and CCM Health clinical staff need 24/7 virtual access to your practice, so that any urgent needs can be addressed regardless of the time of day or the day of the week. And as the billing practitioner, you're also going to need to approve and sign the care plan, as well as the medical record notes. And you will have to ensure that the patient receives a copy of the care plan. And we can work with you on that to ensure that the patient does receive a copy, but between either CCM Health or you, somebody has to be providing the care plan to the patient in a timely fashion.
Ms. Beverly Gibson, if you can cover our physician liaison that assists the practices in practice transformation, their role, their functionality, and what they deliver on day in, day out access.
Well, one of the things that I think really sets CCM Health apart is the entire cadre of people that are behind the physicians and are ready to help at any moment. We do have a chief medical officer that's dedicated to clinical oversight. We've got a compliance officer. We have the entire department that I talked about before that's dedicated to quality assurance. We have IT people who can help with the technology, but one of the best people on the team is the physician liaison. And this doctor actually meets in person at least one time per month with every single one of our practices, goes over the care plans, goes over any gaps found in those care plans, and really helps the new physicians, the new practices to get on board and to understand the whole process. So those are some. It's a pretty good safety net. It's better than a safety net. It really is assistance with the tightrope.
Many physicians have difficulties implementing new technologies. They have difficulties making sure that they allocate resources, and drafting policies is an extremely difficult process. How can we help facilitate that process and ultimately bring that process up to standards of PCMH, patient-centered, for those who need a description, patient-centered medical home, which is considered one of the golden standards, to demonstrate your practice compliance if you're a healthcare infrastructure. That's obviously Joint Commission, JCO, and others. How can we facilitate that process, and what do we have to offer to the practices that need help?
Well, we have a couple of people. One is our regulatory guidance expert, and he has quite a bit of experience, and he is always available for one-on-one guidance. But then we also have compliance experts, overall compliance, but also as they relate to coding, billing, and but mainly billing and coverage issues with Medicare.
Beverly, I'd like to touch the aspect that besides chronic care management, there's also a tool of remote patient monitoring for healthcare providers that is available as part of the prevention. So for the patients that are diabetic, it's connected devices and blood glucose monitoring. For the patients that are hypertensive, it's blood pressure devices that are as well connected. Can you touch on that subject and describe to our listeners how that works, how that functions, and what do they need to do in order to implement that within their practice and apply?
Well, there are a number of physiological measures that are taken. You touched on a couple of them, but obviously you had said blood pressure, that's accurate. And then we have the A1C levels, oxygen saturation level is another one, and weight. But the important thing to know about this is that there are 4 components. 2 of them have to do, well, at least one of them, I think, has to do with getting the patient just started. And then one of them has to do with monitoring the levels every month. But then others, the other 2 have to do with actually talking to the patient about their levels and what they're doing right, what they could be doing better. And that's an initial time code plus an add-on time code if necessary. And those are additional services that CCM Health provides.
I think that was a very good overview of what is necessary and what one should expect to have or set as the bar of quality. Can we go over the financials, the actual codes and the reimbursement and the changes within those fee schedules for 2022 from 2021?
Sure. There's a lot of good news, actually. And I find this to be pretty significant because the reimbursement from CMS for most services was trimmed down. But in a nutshell, we have 2 main codes that we use for CCM services. And the first one is 99490, and that is for the initial 20 minutes. And that reimbursement increased from $41 to $64. That's about $23 per service, but it's really a whopping 55% increase. And then there's also a second code, and this is for the second and third rounds of 20 minutes of CCM services. That code is 99439. It also increased. It increased from $37 to $48. And that's obviously about $11 per 20 minutes, and that is a 29% increase. So I really do find that quite extraordinary. And I think it goes to the fact that Medicare is really putting a greater emphasis on CCM services because they recognize the benefit for patients. They understand how it reduces cost, and they also acknowledge the substantial resources that go into providing the services.
So if you were to give the last few words of advice for the practices that are currently conducting population health initiatives and services actively, And for the practices that are thinking about it, or for the practices that are hearing this for the first time, what would it be?
So one of the things that you might be wondering about is what are the benefits for your patients? And I think that's really important to discuss. But this heightened access to care actually slows and can even reduce functional decline. And it's been proven to reduce hospitalizations and emergency room visits. And of course, that reduces the cost for both patients and the healthcare system. And the clinical staff work to equip patients with tools that they need for self-management of their chronic conditions. And with these goals that are specific to the needs of the patient, then that ultimately improves the health outcomes. And I think that those benefits for the patients, coupled with the fee increases, make the services quite appealing to most physicians. So whether we are currently providing services for your patients or you're considering joining with us soon, I don't think there's been a better time for your patients to receive all the benefits of chronic care management. We're going to be sending you an invitation to a one-on-one session where you can ask questions, especially those that might be specific to your practice. I do want to assure you that the session is not going to be a sales pitch. The point of the session is to answer your questions, to see if you have any gaps in your regulatory process, to do some financial modeling to see how our model might specifically benefit your practice and your patients, to see if you're a good fit for us and we're a good fit for you. So I do want you to know that you should not take my word for everything that I talked about today. And actually, I was only able to give you an overview. I wasn't able to go into all of the specifics of the program, although I am happy to answer any questions that you have. I would encourage you, though, to download the PDF file. There is a link that's provided for you as a part of this presentation, and it takes you to the CMS document that goes into great detail about all the requirements of the CCM services program. And that is always the best source. I try to break that down for you, but naturally they are the experts, and that is where I go for my information. We are more than willing to invest an hour of our time to make sure that your objectives and our objectives are in line and that we would work well together. So if you can invest an hour of your time, then respond to the email that we'll be sending out, and we'll schedule a time that works for you. And in any case, thank you so much for your time today, and we will look forward to continuing this conversation very soon.
Thank you.